With the nice weather out there, and of course spring sports season right around the corner, and kids are practicing football, soccer, baseball, other sports all over East Tennessee. More than 46 million children play sports each and every year in the United States, and 1 in 3 is injured seriously enough to miss practice or games, according to Safe Kids Worldwide. And on Tuesday night, we heard on ABC World News about doctors seeing something you normally might associate with professional athletes: more ACL tears in our children. Well, joining us now from Children's Hospital is ER Director Dr. Ryan Redmond. Dr. Redmond, thank you so much for coming in.
Of course.
Did that report that came out last night about ACL tears in kids surprise you at all?
It does a little bit, but it goes along with a little bit of what we're seeing as far as the way that kids are training. They're starting earlier to kind of train for these sports like adults are training. And kids' bodies are not made to do repetitive things same time over and over again. They're made to be jumping, playing, doing very different things. So even if you've got a child that's in a more kind of serious competitive sport, it's important to vary that training routine and have them do different activities to strengthen all of their muscles and protect their ligaments.
Fractures and sprains, obviously a big concern, not just with our kids playing sports, but really just this time of the year. They're so excited to get outside right now. What should parents do? How do they know when maybe a fall is something more serious, like a fracture or a sprain?
So typically what you're going to be looking for is loss of function. So if you can't bear weight on it, you can't use that extremity in the same way that you normally do, or of course any focal pain that hurts in a specific spot, and that's more persistent than you'd expect from just a bump or a bruise, then that's something that should be seen.
And cuts and lacerations this time of the year, another big concern as kids are heading outdoors. How should parents treat that, and when should it go from just being treated at home to coming to see you?
Typically, anything that's big enough as a break in the skin that's gaping at all. So if you're able to spread it apart and there's a good gap there, that's something that usually will look better if it's closed. The other thing is you always want to make sure, whether or not you're getting seen and they need sutures, that it needs to be cleaned out really well with just regular tap water if you're at home. And of course, if you kind of need a repair, we do a more extensive clean out.
All right, all good information there. Let's talk about what is the most serious injury or common injury you do see from sports-related accidents with children.
Certainly that would be concussions, and of course there's been a lot of emphasis, which is appropriate emphasis, on the proper care for concussions in the last several years. So people, I think, are starting to really understand now that if you have a head injury with any alteration of mental status, any dizziness, anything that we used to call just getting your bell rung and getting back in the game, that's something that indicates you need to stop that activity immediately and seek proper clearance before you go back to sports.
Dr. Redmond, great advice as we move from spring and then into the summer months, because lots of kids will be out there and being active. Thank you so much for your time.
Absolutely.
We appreciate it. Now, if you have a question or anyone about your child's health, all you have to do is email Lori Tucker at ltucker@wate.com, and be sure to tune in every Thursday right here on 6 News at 5:30 to see if we use your question on the air.